So, no, it's interesting. I think we're in the midst of what we call a paradigm shift in healthcare. Over, the 1950s to 2000s, the paradigm has really been about drugs and cutting it out. That's what we do. If you have a problem, if you're depressed, go on a drug. If you have cancer, cut it out. And I think we're moving to a paradigm of neuromodulation, which is the use of electricity to control diseases in addition to drugs.
This is Dr. Peter Staats, who is a pioneering physician and thought leader in the field of pain management and neuromodulation. As the Chief Medical Officer and co-founder of ElectroCore, founder of the Division of Pain Medicine at Johns Hopkins University, and founder of the Vagus Nerve Society, he has been at the forefront of exploring innovative, non-invasive approaches to treating pain and improving health, especially through the power of the vagus nerve. In this episode, we explore how vagus nerve stimulation, also known as VNS devices, are shaping the future of medicine and how they can help regulate stress, enhance recovery, and support whole body health. Welcome to Wired for Connection, a polyvagal podcast. I am your host, and my name is Travis. Peter, I'm so excited to have you on today to kind of jump in on what we're doing here at PVI and for Wired for Connection, and having you on as part of these first few episodes, kind of the core foundation of what we're building here, I think is so important given the work that you're doing and the overlap with tech, vagus nerve, stimulation. But before we jump into kind of the tech part, which is I'm actually really excited to hear about this tech and how we can use technology to help us holistically. I'm wondering kind of what led you to jump into studying the vagus nerve, and then what inspired you to start the Vagus Nerve Society?
Sure. So this is a long journey. So Travis, thank you very much for having me on your podcast. This is wonderful to be with you. It's been a long journey. So my background was I am the son of two psychologists. My dad was a very well-known psychologist, created a unified theory in psychology, invented timeout and other aspects of behavioral learning that were very important back in the 50s and 60s. I became a physician, so fast forward a number of years, became a physician, an anesthesiologist, and I started the pain division at Johns Hopkins University for the Department of Anesthesia. And in that capacity, I started implanting a fair number of spinal cord stimulators and other neuromodulatory approaches, became president of the North American Neuromodulation Society, the big society that oversees the field of electricity and medicine. And about the same time, I learned my son had peanut allergies. And I recognized the power of electricity in controlling diseases such as angina, peripheral vascular disease, and wondered, could we figure out a way of stimulating the nervous system to block the airway reactivity or the anaphylaxis that we see with peanut allergies? And embarked on a series of studies to try to figure that out. Worked with my friends up at Columbia University, where we, in fact, figured out how to create a model of airway reactivity and then block the airway reactivity in a guinea pig. And started studying humans. Initially, it was a percutaneous device. So basically, we had to place an electrode under ultrasound onto the vagus nerve. Then along the way, we figured out how to do this non-invasively, which opened up a lot of different aspects. But I get ahead of myself. While we were studying the people with airway reactivity, patients started to say, my headache went away. And we then started to do some real deep studies on the vagus nerve, central neurotransmitters in the brain that occur with vagus nerve stimulation, the peripheral aspects of vagus nerve stimulation, and a whole world opened up for me of the possibilities of what the vagus nerve controls and how vagus nerve stimulation could potentially be helpful in a variety of diseases, as well as in wellness and optimizing health.
Wow. So really, I mean, a pioneer, very much so, of let's figure this stuff out and experiment. And your son was this, kind of a catalyst to you already doing work, but really kind of sounds like shifted you into a different gear to test things out. And electricity, I mean, what it really fascinating. I don't think most people are thinking about that. I know I'm typically not thinking about that in my day to day of, how can electricity help this? Just is not my world. But when I'm hearing it, I'm like, it's fascinating. It blows my mind that we can help people in a way that isn't really what most people walk around pondering about.
Yeah, I'm
so you
weird.
started this as
I'm kind of yeah. So no, it's interesting. I think we're in the midst of what we call a paradigm shift in healthcare. Over the 1950s to 2000s, the paradigm has really been about drugs and cutting it out. That's what we do. If you have a problem, if you're depressed, go on a drug. If you have cancer, cut it out. And I think we're moving to a paradigm of neuromodulation, which is the use of electricity to control diseases in addition to drugs. So when you stop and you think about from a medical perspective, and I know a lot of your listeners are psychologically oriented, as am I, but when you stop and you think about the best thing that we have for a variety of different disorders, it's electricity. If it's back pain, it's a spinal cord stimulator. If it is incontinence, it's a sacral nerve stimulator. If it's bradycardia or arrhythmia, it's a pacemaker. And what we're learning now is how to harness this in a non-invasive way to control a myriad of symptoms from rheumatoid arthritis to post-traumatic stress disorder and everything in between. Now, a lot of this is still science and a lot of still research projects going on, but there has been an explosion of interest in the vagus nerve and vagus nerve stimulation in controlling diseases that we didn't used to think was just neurologic, like rheumatoid arthritis, for example. I mean, we didn't used to think of that, but now there's great research going on curing rheumatoid arthritis with electricity in patients who have failed the biologics. So it's just a fascinating area.
Yeah, no, it's funny you said rheumatoid. My brother has rheumatoid arthritis, and some pretty intense medications he had to take, which really has helped.
Yeah.
But I know that there's also some possible side effects of some of these medications and stuff. My mind went there. I was like, wow, fascinating. We could use this vagus nerve stimulation to, for some to cure it rather than a medication. And is it, I'm out of curiosity, side effects of that? Is it differ from a typical medication? Same?
Yes, it actually appears to be much, much safer in terms of side effects and risks. All of the biologics knock out a whole system. They may knock out your TNF system, or they might knock out, entire system of cytokines, whereas electrical stimulation normalizes it. So patients with rheumatoid arthritis may have elevated levels of TNF alpha. Some of the biologics may knock it out, whereas this may just stabilize it and keep it at a normal level. So I don't think we're ever going to be in a position of no drugs, but I do think we're going to prioritize electricity to a greater extent. Albert Einstein in 1934 said, the physician of the future will be the master of both the chemical side, drugs, and the physical side, electricity. And we're now just getting to the point of realizing his vision, close to 100 years ago, of embracing electricity in medicine to optimize health in any number of different domains.
Yeah. Well, that paradigm shift too, speaking with some other colleagues, is that I think there's even an approach from a psychological perspective as well that I've talked with psychiatrist friends, psychologists, therapists, and in this industry of more of a holistic approach too. Like, hey, medications can be very much life-giving and effective for people. And sometimes this may not be the right course, but I think that's been a little more of a narrowed view, but now we're opening up to other possibilities. And even hearing in the medical industry, we're looking at expanding, and it's probably due to technology and things we now know versus what we knew 30, 40, 50 years ago.
Yeah.
Which is really promising to see. Wow, we're opening up a myriad of ways of healing and integration for, again, variety of things that maybe we never thought were possible to be healed. And specifically in your case with the research you're doing, which is very fascinating, is the use of electricity to bring balance. I like that. It's not eliminating, it brings it into a new balance, a new homeostasis that might be more integrative.
I just recently finished working on a documentary, Hacking the Vagus Nerve. And what we talk about in that is that we're looking for the root cause problem. Lots of Western medicine is used to treating symptoms. I'm anxious, take a pill. We're more interested in understanding what is the physiological underpinnings of anxiety and then how electricity may modify that. It's not symptom control, but it is really understanding the disease at its root cause, and then how our body, which is a electrical chemical being, fires on electricity, and how that electricity sometimes goes off, and that distorts the chemical side of things, and how we may be able to renormalize things by boosting electrical function.
Yeah, that's, again, so fascinating, this shift of not just the symptoms that kind of one, like the medical model of, which again there's a point and a purpose of treating symptoms and symptomatology, as well as, we got to get to that root. And that's how even when I work with clients in my practice is, hey, yeah, I want to understand what's happening now and maybe give you some tools or skills now, maybe a medication if I think it, depending on where they are, like just to kind of help now. And it's always about figuring out where's this root cause. If I don't find the root cause, the Band-Aid is eventually going to fall off. And so I'm always as well thinking of that kind of both and, like now, and we still need to come back here and address, deal, bringing it into alignment. Because if we don't, I find, and even the research and what you're doing is, it doesn't really fully bring into that kind of that integration. It just kind of comes back up again, rather than giving them an equipping and changing the narrative or the story. I do a lot of story, narrative as well when I work with clients, and that story is powerful and often starts somewhere, and it's manifesting now in maybe anxiety or depression or, isolation or, manifestation and addiction issues, things like that. But there's a story as to why, and from the polyvagal perspective, there's a reason. It's a regulatory response to trying to deal with a dysregulated nervous system, and they found it's beneficial even in the short term. So it's so exciting to hear that there's this shift in all aspects of the health, of healing, both in medical and psychological. And you said something, which is kind of this next part that I want to dive into, is the role of the vagus nerve, and kind of anxiety and stress and inflammation. I'm wondering, how does that vagus nerve, how does it influence anxiety, inflammation in the body, stress, and what are some common signs of like vagus nerve dysfunction that you're seeing in the work that you do?
Let's start with anxiety and stress. Let's step one step back. Let's start with inflammation. Inflammation is incredibly important. It's good for you if you get an acute bacterial infection. It is extraordinarily damaging if you are exposed to chronic inflammation. And this is a backdrop that we all have to get on the same page about. Yeah. That's why people tell you to eat an anti-inflammatory diet, to lose weight, to do certain things that keep your inflammatory levels down. It's associated with cardiovascular disease. It's associated with cancer. It's associated with pulmonary disease. It's associated with a myriad of different disorders. So acute inflammation can be good. Chronic inflammation is extraordinarily damaging. Yeah. Now, what people don't recognize is that teleologically, your body has recognized that this is bad and has developed ways of blunting the inflammatory response. The key one that people don't know about is the vagus nerve. The vagus nerve has both central, going up to the brain, and peripheral, going to the spleen, the gut, and other areas, direct projections to the various cells in your body, what's called the macrophages and the microglial cells in your spleen and in your gut and other areas, that these cells produce inflammation. There's a reflex that when there's inflammation going on, the brain gets information up to the nucleus tractus solitarius, which you will know if you're a PVI person. It's the area of the vagus nerve cell bodies. It goes up there. There's information that's processed, and then information that goes right back down. And in that information, it says, turn off that inflammatory response. Turn it down. And That is incredibly important in mitigating what's called the cytokines that are associated with stress responses. So studies are going on, and we talked about rheumatoid arthritis. There are studies with inflammatory bowel disease. There are studies with diabetes and control with the efferent vagus nerve stimulation. But interestingly, there's also work going on with afferent stimulation. Back in 1997, the first implanted vagus nerve stimulator was approved for epilepsy. And they realized very shortly thereafter that patients with major depression were getting better. They actually got an FDA approval for depression back in 2005 because with an implanted vagus nerve stimulator. Now, it's rarely used because they're very expensive, they carry risks, etc. However, it's been recognized for quite some time that the VNS, the vagus nerve, actually controls depression. Also, we've published a paper. I don't actually think it's out yet, but it was accepted for publication on external VNS, non-invasive vagus nerve stimulation in patients with sleep and anxiety disorders. And on average, when people are asked on a scale of 1 to 10, how much did you help with your anxiety and your depression and your sleep disorders? They reported on average about 8 out of 10. So really profound improvement. A group in Alabama, at the University of Alabama, have done studies, small study on depression. And there's things rolling out all the time on the use of VNS for non-invasive approaches to controlling anxiety, depression, sleep disorders. And there's a tremendous amount out there. Now, you get to a very, very interesting question about vagus nerve dysregulation. My last book just came out on vagus nerve stimulation. That's, not too exciting of a title, but it's vagus nerve stimulation.
It's very direct. You're very clear.
And chapter 1 is on what we call vagus insufficiency syndrome. And it's interesting that if you take a look at patients who come into a medical clinic that, got primary migraine disorders, it's rare that they just have a migraine. They also have anxiety. They also have depression. They also have gastrointestinal disorders. They have a number of these sets of different problems that on the surface are completely unlinked. And the primary care doctor of the 2000s says, okay, you've got anxiety, go to the anxiety specialist. You've got depression, go to the depression specialist. You've got, migraines, go to the neurologist. And they send people out across in multiple.
It's very disconnected. It's like pieces.
Yeah. And it's what we call splitters. We split it all up. But interestingly, in a study we did in about 2010, when you stimulate the vagus nerve in the patients with migraines plus GI disorders, migraine plus fibromyalgia, migraine plus, and the list goes on to things that are linked.
Yeah.
The other symptoms kind of just melt away, which led me to believe that patients don't have 3 disorders. They have vagus insufficiency, which you call vagus dysregulation, which actually may be a better name in some ways, but they're not functioning correctly. And it is causing disorders that have been largely unrecognized as such. But if you do searches out there, you can find medically unexplained symptoms. It's a very pejorative term for patients who have got really complex problems, and doctors just say, well, you're a medically unexplained symptom. Yeah. We got to learn, we got to do better. We got to explain it. And I think you frequently see these medically unexplained symptoms and things like long COVID, which is shown to be related to a damage of the vagus nerve or up in the brainstem of the nucleus tractus solitarius. So we will get to the point where people recognize these separate, disjointed diseases and disorders are actually related back to a central brainstem or vagal problem.
Yeah, it made me think of all those interconnectedness with these kind of manifestations of some level of dysregulation or disintegration within the body, and it's being manifested through, like you said, fibromyalgia, migraines, anxiety, all these different manifestations. Or I think of working with quite a few people that have like POTS, some of these other like inflammation, and
Yeah.
you really, there really is an interconnectedness, and that splitting, I think, just my opinion, and I could be wrong, and please, people have opinions, but I think part of the splitting is, I think it's probably the supply and demand of physicians and people, the healthcare workers, and trying to meet the demand for the need.
Mm-hmm.
So I think there's that, like it's an unintended side effect of like, hey, I can't deal with this, go here, go here. At the same time, I think an unintended side effect is maybe because it's being looked at in isolation, not as a whole, that in a way we might do more damage at times, or prolong some of these things, or not really get to the root cause. And I think people can stay in limbo for a long time at times, even good intentioned physicians or therapists or whatnot, versus looking at that whole picture.
I'm sure you're correct. And I don't mean for a minute to think that the physicians and the therapists aren't doing this with the best intention, but if you don't know to look for something, you're never going to find it. So you have to be able to think about things differently. And I hope one of the messages that we get across in this podcast is, when you see these complex patients, it's important that you think that there may be a root cause and understand that. And maybe I'm wrong. Maybe it's not the vagus, but stop and think about it, because more often than not, you'll find that there is a root cause. It's, high levels of mercury. It's inflammation. It's damage to the vagus from a virus or a trauma. There are a lot of different things that can cause this, but physicians today should be thinking about that.
Vagus nerve dysregulation or dysfunction. And as we begin to address that, we are seeing other manifestations, psychological, physiologicals, begin to reduce significantly, and even being reported that, which is very promising to see. Wow, there's something powerful here. We need to take this into consideration. Most that I've talked with don't even know about the vagus nerve. And it's not that this is their fault. It wasn't part of the training. And so you don't think about these things. I think the need to continue to update, so to speak, our app, our brain, of what's the new research showing as healthcare workers, as clinicians, psychologists, medical professionals, medical doctors. We need to stay up to date with some of the latest research and what's going on, because we're missing out on so much valuable information. And I'm wondering, as we pivot here with this vagus nerve dysfunction or dysregulation, kind of how we're seeing it manifested, and how we need to think differently and have this paradigm shift with the work that you're doing, specifically with the VNS, or the vagus nerve stimulation, and the devices. A few questions coming, and the first one I want to ask is, how can we stimulate that naturally to improve, vagal toning? That what do you find that's functional or effective?
Yeah. So look, there are 4 general methods of stimulating the vagus nerve. I break it down into natural, implanted vagus nerve stimulators, non-implanted vagus nerve stimulators, of which there are different approaches of non-implanted at the neck and then other areas as well. But let's start with the most basic and most ancient of all medicines, which is the natural methods. Every culture for thousands of years have figured out that stimulating the vagus nerve is helpful for disease and wellness and anxiety. Every culture that I have ever explored. So the ancient acupuncturists from several thousand years ago, they would actually do acupuncture on the vagus nerve. Interestingly, pranamaya yoga is a source of deep breathing that is used that activates the vagus nerve. Cold water immersion activates the mammalian diving reflex and activates the vagus nerve. We've kind of scientificized it a little bit with box breathing and other types of approaches here, but these are really basic levels that activate your vagus nerve. Going a little bit deeper, singing, phonation. My good friend Steve Porges has a Safe and Sound protocol where he's developed specific frequencies that activate the vagus nerve. And when you think about the nervous structure, the vagus nerve has 4 branches that come into your voice box. And these branches are activated with singing and talking. And so laughing, singing, all of these activate your vagus. All of them have good, healthy benefits. And frankly, we've known about this for a long time. We've known that laughter is nature's best medicine. We may not have specified why. So to me, vagus nerve stimulation is in fact a great unifier from the past to today, from holistic medications to Western and the best science. This all comes through the vagus. And I think one of polyvagal's great contributions, history will reflect, is an understanding that the trauma can damage or can impair the functioning of the vagus nerve. And that has been a great contribution, I think, for us understanding and linking things that we've not really understood before. And so, for example, when I was a pain physician, one of the first things that I was taught was one of the predictors of chronic pain is abuse as a child. On the surface, you have to say, why is that? But you know better than I here that if in fact your vagus has been traumatized, your body's not able to heal itself. And so this is a link from what we've recognized in Western medicine, and it's just been kind of out there. But this is mechanistically integrating Western observations with psychological approaches to the polyvagal approach, with most modern approaches of electrically stimulating the nervous system. And it's pulling things together, which I think is important.
Yeah, and I think that's the piece, how I describe it to myself or people I work with or talk. It's like the puzzle piece that connects, makes all these things make sense in a way. Like, oh, that's why it works. That's why we know it works in these ancient, for thousands of years they've been practicing from all different cultures, have found a way, and they may not have had a scientific. They couldn't scan their brain and they didn't have the technology, but there was this, they saw it and they experienced it and they knew, and they probably had a felt sense, I'm assuming, of like, oh, wow, this does work. And we're seeing people get better. Let's keep doing this. And now come to what we're doing in the West. And is that now we could see it. We could see this cranial nerve and where it goes and how it works. And we can now do brain scan imaging when after, pre and post. And so now we could, in a way, science, Western science at least, essentially is, I think, validating what we've kind of known in a way and saying, yeah, we've known this. Now we could it's just, in a way, science is catching up to like what people have been doing before, Western medicine, Western science, which is fascinating. I think it's really, like I say, like truth is truth and eventually comes out. Like eventually the ultimate truth, like everything starts to come into alignment across cultures, across, time.
Yeah.
Which is so kind of exciting time to be in, I feel like, at this time with this kind of shift. And there's all these natural ways from different backgrounds, which is really, really amazing that there's so many ways that we could naturally improve vagal tone. That is to restore, and I'm assuming heal. Like, would you say that through this vagal toning for the listeners, as we do natural, can that bring some healing and balance and integration to the vagus nerve by doing these?
I'm a Western clinical scientist, and I'll say that my language is a little bit different, but the short answer is yes. And one of the things that we take a look at is your body has different parts of your nervous system. And just to level set people, there's the autonomic nervous system, which has 3 components. It's got the sympathetic, the fight or flight. It's got the enteric nervous system, which is your GI tract and information coming up and giving information to the brain from your microbiome. And there is the parasympathetic nervous system, which is largely the vagus nerve.
Yeah.
Most people think about the autonomic nervous system in the sympathetic and the parasympathetic, and sympathetic being fight or flight. With the fight or flight, it shunts the blood away from your organs and ability to heal, but it allows you to run away from a saber-toothed tiger if that was chasing you back a few thousand years ago. The parasympathetic is rest, relax, and recover. And I believe that when we activate the parasympathetic nervous system, we provide an opportunity for your mitochondria to be adequately energized and healed. And so that is, in fact, how I would use those terminologies of healing, not anthropomorphizing a cell, but it is allowing the cell's structure to work optimally.
Yeah. Well, and I love that explanation. Again, I think being true to your language, and it's saying the same thing. It's just different language, right? And I think that's important to stay true. But what I'm hearing is that, it does, that these practices do have an impact, which is why they've been practiced, and we saw healing happen. And now it's one of many. We might need more. And that kind of leads us into the second part of, well, that's some natural ways, and there's tons of them. And that's why I actually sing on the way home often, because I know for me, and I used to do choir as a kid. And so I always feel better when I sing. It always feels good, right?
Yeah.
Even when you're angry, you just kind of get that energy out, now I can relax, right? Yeah. So many uses of singing, and my kids love it. So it's such a fun way for them to play and have fun and release and shift states. That's natural. So what are some of the tell me more about these devices and the ones between surgically implanted versus external. Can you talk about the function, how they help?
Sure. So the OG, the original vagus nerve stimulator, electrical vagus nerve stimulator, was a implanted vagus nerve stimulator in the neck that is connected to a pacemaker in the chest that stimulated the vagus nerve pretty consistently and constantly over a 24-hour period. And these were implanted for children with epilepsy after aggressive measures had failed. Many medications, even cutting out the foci of abnormal brain tissue, going in and doing brain surgery. After that, these therapies still seem to work. And they are effective. They are really good tools, but they're invasive. The vagus nerve runs within what's called the carotid sheath, which is where your main blood supply to your brain goes. And there is a small but real incidence of hoarseness after an implant, because you could potentially damage some of those nerves that go to your vocal cords, and they're expensive. So I'm a big fan of them, but I also recognize that there are limitations of expense and risk of these approaches. We developed a non-invasive approach of stimulating the vagus nerve in the neck, whereby we created a frequency that doesn't hurt, that is safe, that doesn't activate the fibers that cause your heart to slow, and just gets the other fibers by simply placing a device over the neck, placing it with a little bit of conducting gel, turning it on for 2 minutes, and that's it. So it is a biohack of activating the vagus nerve, and you're about 160,000 fibers on average in the neck on either side, and we can optimally stimulate maybe 85% of them, the ones we want to stimulate.
Wow.
So,
and how long have these been around? This device that you guys have created, this device, which is sounds like very high tech. So how long have these been?
Yeah, the first approval was in Europe in 2011, and it's been used by the National Center for Clinical Excellence there for patients with cluster headache. They found that not only does it help the cluster headache, but it actually saves them money to use it, because they stopped doing other things. They stopped getting oxygen and injections and other types of things that are otherwise done. So they've covered it since about 2000. I don't know exactly when they started covering it, but it was approved via what's called a CE mark in 2011. In the United States, we got a FDA clearance, a de novo process for episodic cluster headache back about 2017, and subsequently have approvals for prevention of cluster headache, acute treatment of migraine, prevention of migraine, treatment of adolescents with migraine, paroxysmal hemicrania, hemicrania continuum. In 2022, we got a breakthrough designation for post-traumatic stress disorder from the FDA, which is not the same as a full approval, but it's recognized the studies that have been done for PTSD, and thought this is going to be something that's of value. And we're still working with the FDA on that topic. During COVID, we got a emergency use authorization for difficulty breathing due to COVID. I basically cleaned off all the old data that we had from many, many years ago when I was working on the guinea pigs and early humans with asthma, and the FDA said, "Yeah, look, people are dying from this. Let's let you use this during the time period of COVID." Now that COVID no longer exists, or the emergency exists, that EUA has expired. But we did some really interesting studies looking at those cytokines we were talking about at the outset, dropping the cytokine response, which was associated with people's death. So lots of different areas and lots of research going on, from preventing a stroke from occurring in situ, getting worse and worse after someone's had a stroke, to there's a company that's not us, but working on patients who had a stroke, stalled in their recovery, using vagus nerve stimulation to improve neuroplasticity in the brain to allow the body to start functioning again. So lots of different areas there. Then there's auricular devices. There are devices that go on the ear. And interestingly, there's a small branch of the vagus nerve that goes to the ear. If you're only stimulating that nerve, it's probably not as effective as stimulating the main branch in the neck, because it only goes one way into the brainstem, whereas this one goes up and down and et cetera. Yeah. But there's interesting work going on multiple nerves. So not just stimulating the tragus or the vagus nerve in the ear, but stimulating the trigeminal nerve, the tragus, the upper cervical nerve roots. And you can get to a lot of those nerves in the ear, where we're looking at diabetic neuropathy and treatment of diabetes. So things that have traditionally not been considered part of an electrical domain, but we're rethinking things.
Yeah. I mean, very, like, going back to what I said earlier about the work you've already done, and it's still pioneer. It's like you're paving the way and looking through how else can we help and think differently, think outside the box to be more effective with less side effects, and maybe be more effective. And you said something about the PTSD caught my ear, because it's, I do a lot of trauma work too, and I do EMDR and other somatic stuff and polyvagal, kind of incorporate these things together. And I'm curious, with these vagus nerve stimulators, at least the ones that even you designed, what else have you seen it being effective in treating, like anxiety, depression, stress? Like, do you see the efficacy there?
Yeah. So this is a lot of Doug Bremner's work out of the Veterans Affairs at Emory University, but he was able to show improvement in the PTSD checklist scores, so the patient's experience. He was able to show an improvement in the clinical global impression of change. He was able to show changes in blood flow to various areas of the brain. He was able to show improvement in the size of areas of the brain, like the insula, which kind of, seems to shrink and kind of be regrown. And very interesting to me and thematic with me is he showed that patients with PTSD have actual spikes in these inflammatory cytokines, IL-6, the same inflammatory cytokine that was associated with mortality in the COVID patients, spikes in patients with PTSD in response to traumatic scripts. He was able to blunt that significantly with vagus nerve stimulation preemptively.
Wow.
So these are sick patients in the Veterans Affairs with PTSD, but he's linked the mechanism with brain imaging and cytokine response with clinical outcomes. So it kind of makes sense of why he's doing it. He's actually done the work to show that the patients are clinically improving, and that the brain imaging and the blood flow and the cytokines are all significantly improved. So I think this is an incredibly promising area. And currently the only approved therapies for the FDA's perspective for the treatment of PTSD are two antidepressants, and they don't work very well. So we really do need to broaden our approach to this problem.
Yeah. Well, I think we need to update it significantly. I agree. I'm with all this, everything going on that has gone on, I'm curious for you personally, what is something that you're most excited about in the work that you're doing with kind of the vagus nerve or the VNS stimulators? Like, what gets you most excited right now?
Well, back to your original question, why did I start the Vagus Nerve Society? I think this is an incredible new way of looking at things for many different disorders, from diabetes to PTSD to blocking a stroke in situ, or if there's someone's having a stroke, keeping it from evolving and the devastating consequences of that. PTSD, we have 15% of our veterans returning from Afghanistan and Iraq wars who have PTSD, and it's going up every year. We need a better strategy. We need to be able to help these people to a greater degree. But I started the Vagus Nerve Society because I was aware of people, and I co-founded it with Mark Tager, but we were aware of the incredible interest that we're seeing in the vagus nerve from people from cardiology to gastroenterology to psychiatry. And nobody really knew that the others were working on this and existed. So I wanted to have a home more for the medically oriented people. But as I got into this, I realized the mind-body interface aspect is extraordinarily important to bring in the psychologically oriented people as well, but have a home for people who are interested in that critical structure called the vagus and the nucleus tractus solitarius, and learn from each other. Say, okay, well, this person's working on Parkinson's disease, and they found X, Y, or Z. And a very stark example is we learned a few years ago that we could alter the evolution of a stroke by stimulating the vagus nerve, but it had to be done in a slightly different paradigm than what we've been doing for headaches. When we apply that to Parkinson's, we're learning that might actually improve Parkinsonian gait and other problems, but we may need to do things a little bit differently. And we can learn from each other and activating the vagus. So but my goal was to have a forum for discussion between clinicians and scientists. And it's evolving to allowing patients to understand that they should be asking questions of their doctors about other strategies that might be helpful for them.
Yeah. I love that we need to invite, other individuals that work in a different, similar, but, kind of parallel, different area of focus, the psychological and the medical. It's like we need all the mind body. We need everybody to work together to say, okay, what are you seeing? Hey, I'm doing the research and science of it. So what are you noticing in the room as you sit with the patient? What are you hearing? And
yeah,
I think that is that integration of like, we need to bring us together versus being separate entities of being, splintering or these sectioning out. It's like, no, let's all communicate together, because really we care about this person, the individual, the human. And so we need to learn from one another. Because everyone has something to offer. And I love that that's what the Vagus Nerve Society is about, is that it which really is the mission too of PVI, Polyvagal Institute as well, is it's about giving away generously and, bringing in the fold and understanding to learn more. And so I love that that's what your society is about. And to kind of wrap up, final two questions here. You're speaking at the upcoming Polyvagal PVI conference. What's one thing or an insight, something you're really hoping to get across or share at that conference?
Well, look, I think the Polyvagal Institute has done enormous value in looking at the problem from a different perspective, but providing a framework for therapists to understand a new strategy for treating their patients.
Yeah.
It turns out that framework has a lot to offer Western medicine. And what I hope to do is bring in and create a linkage between the Polyvagal Institute with the therapists who have been working in this field, with a unified theory of why this works and how does this all connect everything from sexual dysfunction and rheumatoid arthritis and anxiety to post-traumatic stress disorder, but to help create that link. And then provide one tool in your toolbox to be able to help the patients who need a different approach.
Yeah.
And do not believe that this is something that the devices that I've built or worked on over the years are going to solve all of your problem. I don't believe that at all. But I do think it's important to have the tools in the toolbox and to have a framework for looking at the problem such that you think about this. And if it's appropriate, that's great. And if it's not appropriate, let's try something else. But it's the goal here is to link up, to build on what the tremendous work that's been done from a theoretical orientation, and to bring in the 600,000 physicians who might be interested in learning a little bit more about, why heart rate variability is important and why patients with trauma may have a different response to the medical treatments that we're offering, and give some new suggestions.
Yeah, I love that. As we work together, and expanding our toolbox, I love that. I use that analogy all the time. It's like, hey, it's a tool that you may not always use, and it may not fix everything, but it's very effective when used correctly. And in certain circumstances, that's exactly what you need, right? It's like the idea of like, hey, hammer's great, in a lot of ways, but we need more than a hammer. It's like anything. So having, like, I'm interested, I want this tool in my tool bag. So with the final question is, those that are interested in VNS devices, those that want to learn more, like, what should they consider? Where should they go? Like, can you help us point us in a direction to kind of?
Well, yeah. So look, there's been a lot of interest in the vagus nerve and vagus nerve stimulating devices that have exploded, as I said earlier, over the last 10 or so years. The challenge for the consumer is figuring out what's been studied with science and actually works, and what is just a marketing ploy. And I can tell you very definitively, if you're using the wrong frequency, this is not going to work. And if you're using a bad frequency, you could actually slow the heart and it could be dangerous. So the devices that I've worked on there's a medical device called GammaCore device. There is a wellness device called TruVaga, TruVaga, that is just classified as in a consumer electronics, and people can go on truvaga.com and buy it and use it for themselves. And basically that's used for, sleep problems and mood problems, but there's no medical claims associated with it because it's not an FDA approved device. So my recommendation on the surface is look at the devices, look what's been studied, look at the frequencies of what they're using. And if it's not the frequency that we worked on, make sure that they've actually done the work to show that what they're claiming, and they're not just looking to the papers that we wrote a number of years ago and saying, oh, vagus nerve stimulation works. Because if they're using the wrong frequency, I can almost tell you there's a very good chance it's not going to work.
Yeah.
And that's a shame, because people will lose out on a viable strategy.
Yeah, which is important. I think you put a really important point on it, that we need to really be clear with, is this marketing? And because people do misuse a whole bunch of information on everything to make a sale, versus the ones that are doing it well and right, or linking to research and showing it, and to be thinking critically. And for your work, is there a way, where can we find the work that you're doing and the research, and to point people to like someone doing the work that's showing, hey, here's what we're finding? Where can we find your work?
Well, look, you can go to the vnsociety.org. I tend to put up podcasts and webinars that we're doing. We're doing really interesting work on performance enhancement of our super soldiers. The Air Force is doing work on improvements in learning and decreasing fatigue, et cetera. We just did a webinar at the beginning of March on this topic. It's up on the website. There are clinical papers under clinical conditions that we load up to try to just, hey, if you're interested in, PTSD, here's a series of papers. And it's not complete, but it's a good start for people to get started. And there's, of course, stuff on polyvagal work that's up there. And, I would encourage people to jot me a note if they're interested in, X, Y, or Z. I'm trying to get people in the right direction.
Yeah, that's awesome. Thank you for that. And I think this is such a rich, it's a different way of thinking, especially from the medical side, and those coming from a psychological side like myself, is it, it makes me think differently too, like other ways that we help those that we're working with and other ways of treating really some level of disintegration or dysregulation, and rounding out the dialogue and inviting in just a different perspective, this paradigm shift. And I, for me, I love paradigm shifts to say, wow, I never thought of it that way. And my hope for this is that as people are listening to this, it just expands them a bit more, takes them another step deeper in a different way. And so I thank you so much, Peter, for your time and sharing. And my hope is that the work that you're doing and that others have done or are doing around this globally, that we continue to find really more integrative ways to help each other, to help the world. Why not? Like that's a wonderful mission to be part of, to do better work and to treat people better and to heal more effectively. Like, what a mission and call in life. So
it's also about understanding what's wrong with people and not just throwing drugs at people. I'm not a no drug guy, but I do think we need to be very circumspect in use of just broadly throwing medications at people for this disorder, that disorder, and really need to understand the root cause of the problem. And I do think that for many disorders, electricity is a wonderful solution as well as symptom control.
Yeah. We need to take a step back and I think slow things down a bit.
Yeah.
And that's, I think, our whole culture. Typically, we need to slow down significantly to see that root cause. Otherwise, we'll keep doing those quick, which again, they do work. We're not knocking it. It's effective in some cases and it's very helpful and life-giving. It just really depends on the person. We need that space and time to really think critically with people and wonder what else is here. I'm seeing these things. What else might be going on that might be something I can't see with my eyes right now?
Yeah.
And so, I'm on that mission, and my hope is that we continue to change that. So, again, thank you so much for your time. You have a wonderful day, and we'll see you at the conference coming up here soon.
Thanks, Trevor. Pleasure to be with you. I look forward to meeting with you in person.
Yeah, thank you.